We'll be joined in just a moment by our good friend Dr. Jamie Taweel to talk about just how critical this procedure, this colonoscopy, is, and when people should go get it, what the process is like, what people can expect, and why this is so critical for people to get this procedure done, and maybe not wait until you're 50, and maybe wait until you're older. Follow the American Cancer Society's new directive to get your first colonoscopy at 45. And if you have other risk factors, maybe it should be a little bit earlier. We're pleased to be joined to talk about this and more with Jamie Taweel, Dr. Jamie Taweel from Grand River Medical Associates, our final guest today on the Oakland County Megacast. Dr. Taweel, thank you for being with us again.
Thank you for having me as always.
Appreciate having you on. So we just spoke with Jennifer Hammond from Fox 2 about, of course, the tragic passing of Jamie Samuelson, local Detroit sports, radio, TV, and print personality from colon cancer at the age of 48. Really has put a new emphasis in the Detroit community, Metro Detroit community, on the importance of getting a colonoscopy. For those who are unfamiliar, what is a colonoscopy and how critical is it or life-saving can it possibly be for someone that gets that procedure done?
So a colonoscopy is a direct visualization of the inside of the colon with a camera. It's called a colonoscope. So basically what happens is the patient would undergo light anesthesia, kind of sedation. They would still be awake, but they would not be conscious to be feeling any of this. As the gastroenterologist, which is the doctor that does this procedure, will advance a scope into the rectum and look at the entire colon to see if there's any polyps. As my old instructor used to always say, not all polyps becomes cancer, but all cancer comes from polyps. So if they can go in there and catch it early and remove it and look at it under a microscope and see if it's a propensity for colon cancer, then you have the ability to save lives. I mean, colon cancer is a big killer of Americans. It's, roughly 50,000 Americans are dying yearly from colon cancer. And it is one of the most preventable cancers, because if you can get to this before it becomes an issue, that's your biggest risk, your biggest prognosticator for mortality is how advanced you find it when you do. And it's a relatively asymptomatic thing until it becomes, once you start getting symptoms of colon cancer, 9 times out of 10, it's advanced to the degree where treatment becomes a problem. So,
Dr. Taweel, what age should someone get a colonoscopy? And on top of that, are there symptoms prior? Or is this just, hey, I'm reaching this age, let me get one?
Okay, gotcha. So every patient should be getting yearly physicals, and during those physicals should be getting age-appropriate cancer screenings. So for example, a female who hits a particular age will start getting, asked to get mammograms routinely, because those are other preventable cancers. Men will also start getting prostate screenings as per the guidelines as they come out to, age-appropriate screening, and colonoscopy is one of them. Now, a colonoscopy, typically there's different, the American Cancer Society released new guidelines suggesting that everyone at age 45 and above gets screened. The gastroenterology guidelines are still at age 50, but you can make a case for 45. So at age 45, you start getting screened for a colonoscopy, and it's typically, every 10 years, but sooner if they find something on that colonoscopy that would require a little bit more of a closer surveillance, so to speak. There's cases where you would need to get it before age 45, and that would be if you have the pre-existing conditions, genetic predispositions for colon cancer, such as FAP. These are like genetic mutations that create a lot of polyps that could be potentially cancerous. If you have an inflammatory bowel condition like Crohn's disease or ulcerative colitis that puts you at higher risk for colon cancer, that needs to be routinely screened. And a first-degree relative with colon cancer. So if you have a brother or a sibling or a mother who has had colon cancer, your screening begins 10 years prior to that, the age of diagnosis, or the age of 40, whichever comes first. So if someone got diagnosed, let's say your mother got diagnosed with colon cancer at age 53, your first colonoscopy should be at 43 or 40, whichever you hit first, and that being the case.
Dr. Jamie Taweel with us from Grand River Medical Associates, with us on the Oakland County Megacast. A lot of people are turned away from getting colonoscopies, not by their doctors, but just by their own psyche, because of the process of getting to the point to have that colonoscopy. Can you speak to a little bit of what people expect to go through as they're approaching that procedure, and whether or not they're going to have pain or if it's going to be an annoyance to them, and why it's still so critical to fight through that in order to get this procedure done that could potentially save your life.
Well, absolutely. The worst, the joke is always the worst part about the colonoscopy is the day before, because that's the prep. And, in order for them to directly visualize the colon, you need to have it cleared. And so you're going to be drinking a prep that's going to, unfortunately, it's not the most comfortable thing in the world. You will be in the bathroom, for lack of a better word, just, clearing yourself out. And that takes a while. And that's what a lot of people get really upset with. Excuse me. The other issue people have is that when they need someone to help drive them, they can't drive home by themselves from these things. So it does tie up a lot of people's time. And it can be, patients are resistant to it for a lot of different reasons. And a lot of it is the prep work, and some of it is the fear that they may actually find something. Other issues remain to be that, I don't feel anything. Patients often say that to me, like, I don't understand why I need a colonoscopy. I don't feel anything. I feel great. Well, that's the time when you want to catch something like that. Because if you get to the point where you're having symptoms, blood in your stool, constipation, abdominal pain, things to that effect, by the time you get that diagnosed and you have symptoms, chances are it's advanced to a degree where treatment becomes a problem. So, not a problem, but your risk for survival starts to go down pretty dramatically. Now, there's other options. If people don't want to get a colonoscopy or can't, for example, they are on blood thinners, or they are, patients that are on oxygen, they are not stable for the light anesthesia that one receives from a colonoscopy. Other options are available, such as Cologuard, which is a fecal DNA testing for colon cancer. So what will happen is a box gets mailed to your house. The patient would submit a sample in that box, mail it back to the company, and they will actually test it for DNA for colon cancer as well as for blood. And if it's positive, then they have to go get a colonoscopy, and we have a little bit more of a risk that there's something potentially dangerous there.
Dr. Taweel, thank you very much for being with us today.
Absolutely.
Appreciate having you on. Dr. Jamie Taweel from Grand River Medical Associates. He's an internal medicine specialist talking with us today about the importance of getting your colonoscopy. It's so critical, and if we've ever had a better example in Detroit, it's been the impact that we've seen from the life of Jamie Samuelson, a local Detroit sports analyst and personality who tragically passed away last weekend at the age of 48. And it affects people young and old.